So you talk about meetings around the world,
Yeah.
right? So there's probably millions of doctors around the world, and everybody has this idea of, I mean, you obviously you want to treat patients, right? And that's the job that you have. And I think that most doctors would like if, though they may be out of a job, if this were to happen, that there was no diseases, right?
Yeah.
Is there, or that there would be cures, like a cure for cancer rather than a preventative or whatever your type of treatment? Given AI, given technology, given these international meetings, and given what you've seen from your now global perspective,
Right.
Where are we headed
So,
with regard to the treatment of cancer, HIV, maybe
Right.
other diseases, health in general?
The HIV docs really have to be commended. I mean, they basically started from nothing and basically turned that into what a deadly disease into basically a chronic disease that just needs to be managed with oral medication, because they have 4 or 5 drugs. Then they've done an amazing job. Cancer's tried to take that same type of route. Unfortunately, early on, it didn't quite have the same success. Now, given the technological advances of being able to sequence a whole genome in a relatively short period of time.
What does that mean for a layperson?
So,
which means me.
You know, the whole genome project was to sequence the entire human DNA to know what the sequence was, what mutations were there, how it coded for proteins, and how it makes the cells function and why we function as humans. Taking that perspective specifically to cancer, where all of that is kind of messed up, has really dramatically increased the availability of new treatments. New treatments that can specifically target a specific mutation in a cell. Minimal side effects, an oral medication that can be taken and having stable disease for years. There's a number of these drugs. I think the biggest, obviously the most impactful thing in the last few years has been immunotherapy. Basically, it's a drug that's given IV, and it basically turns off a negative regulator of your immune system or turns on a positive regulator.
Is this for like HIV or
No, it's for cancer.
Okay.
And basically retrains your immune system to help fight the cancer. And that's been very highly effective. We're now studying what's the role of radiation in terms of the immune system. We know that radiation itself is very inflammatory. It can stimulate the immune system. So we're seeing actually synergistic responses by combining radiation and immunotherapy.
Which cancel each other out in a way?
No,
Or?
they enhance each other.
Okay.
They can enhance the response. So there's that. I think, ultimately the goal is to get through to the most ultimate personalized medicine delivery. So they'll take your blood, they'll take a sample of your tumor, they'll sequence it, they'll understand all the DNA and all the mutations. They'll be able to say, this is the treatment we need to give you specifically. And I think that's kind of where we're heading. AI is definitely having an impact. Even at the last radiation oncology meeting that I went to in San Antonio this year, one of the big talks was on AI and how they can help radiation oncologists get more standardized planning and delivery of radiation oncology. And this is importing hundreds of thousands of plans and letting the system kind of come up with a plan, and then they've compared it to other doctors' plans, and it's not too far off. I think that's kind of where we're kind of heading in the future.
Who runs the AI? Is it Google and Facebook?
I think they're
companies?
working with it. There's other private companies that are kind of doing it right now. I think Google is trying to probably does have a hand in it, but I think right now there's a lot of private companies that are kind of doing that.